Hello, this is Dr. Eric Bricker, and thank you for watching A Healthcare Z. Today's topic is Medicare killing independent physician practices on purpose? So I'm going to start out with a story, and this is the story of Dr. Lisa Egbert, who's an OBGYN in Dayton, Ohio. And she was interviewed by Stat News, and then she also has a YouTube video, tells this horrible story of how she was in solo practice in Dayton for 27 years, almost 3 decades, and she took care of over 2,500 women for that period of time, and she had to close her practice because she was losing money. I mean, she literally had to pour money into the practice to keep it open, and it was completely financially unsustainable. And so finally, with like gobs of tears, she had to close the practice, and her patients begged her to stay open. She was seeing adult women who she had originally delivered as babies, and they had grown up to become her adult patients as well. So it's hugely detrimental to her patients and to the entire Dayton community. Now, why is this happening? So there's this thing called the Medicare Physician Fee Schedule conversion factor. Oftentimes it's just referred to as the conversion factor. And that's the amount of money that Medicare will pay a doctor for different services. Now, that conversion factor for 2025 is $32.35 per RVU. And I've got a different video that explains the whole RVU system. But essentially everything that a doctor does has different RVUs. So like an office visit is maybe like 1.5 RVUs, delivering a baby is a certain number of RVUs, performing cataract surgery is a number of RVUs. So like everything that a doctor does is assigned a number of RVUs. And then you take that number of RVUs and you multiply it by $32.35, and that's what Medicare pays the doctor. Okay, now, keep in mind that $32.35 has gone down. It went down from 2024. It went down by 2.83%. But it has not gone up substantially at all. In fact, adjusted for inflation, the conversion factor has gone down 33% since 2021. Now, it gets even worse. Really, all the proof here is in this specific graph, where we have 2001 all the way up to 2022 on the x-axis. So the x-axis is time, and the y-axis is the collective percentage increase. And this line here that goes from 0 to 10% is the physician conversion factor from Medicare. So it's basically gone up 10% in total since 2001. Now, let's compare that to overall inflation, which is CPI. Look at that. CPI has gone up almost 70% over the same period of time. So the physician conversion factor hasn't even come close to keeping up with inflation. So the cost of running the practice has gone up. The salary for all of the techs and the nurses and the receptionists, etc., has gone up. The rent for the office has gone up. The cost, the utilities have gone up. Everything has gone up. But the overall physician payment has not kept up. But look what has kept up. This top dashed line is hospital payments from Medicare. Look at that. Hospital payments from Medicare keeps lockstep with CPI, with inflation. So the hospitals have been able to, I guess, convince Congress to have hospital payment keep up with inflation. But doctors have not been able to convince Congress to have their payment keep up with inflation. They've essentially gotten screwed. And this is royally important for commercial insurance as well, because commercial insurance is expressed as a percentage of Medicare. So commercial insurance, like private Blue Cross, United, Cigna, Aetna, etc., it pays more than Medicare. And for hospital services like inpatient care, it pays 205% of Medicare. For outpatient hospital services, so you go in, you have just like a CT scan or a same-day surgery at a hospital, that's an outpatient service at a hospital, it's 263% of Medicare. Now, physician payment from insurance companies is only 139% of Medicare. But wait, it gets worse. It's 139% of this lower number. So the hospitals are getting 200 to 263% of this higher number. Doctors are only getting 139% of this lower number. Because the doctors have no bargaining power. They have no leverage. They have no leverage with Congress and Medicare, and they got no leverage with the health insurance companies. So the physician practices have been shutting down, or they've been selling to the hospital systems, where all the hospital system does is they take all this money from up here and they give it to the doctors on salary. They essentially bribe them to come over and work for the hospital, and the doctors don't want to work for the hospital. And this is why I am working with Maroka. Okay, Maroka is a company that works with independent physician practices to set them up as an ESOP, an employee stock ownership program, so that the employees can be co-owners in the practice along with the physician, where they work to increase revenue, to streamline operations, and keep the practice open, which is what the doctors want in the first place. So unfortunately, it's too late for Dr. Lisa Egbert. She said that herself. She said it's too late for her, but it doesn't have to be too late for you. And thank you for watching.